I know some of you are still getting lunch, but I think we're just going to get started as well. I hope you enjoy the lunch. And my name is Greg Zaharchuk. I'm a neuroradiologist from Stanford, and I'm one of the co-founders of Subtle Medical. And I'm very excited to, I guess, be the MC to some extent of this excellent panel that will be speaking about some of the work that Subtle Medical has been doing over the past year. So we're lucky to have Dr. Larry Tannenbaum to speak about some of the updates, particularly on the MR side. Dr. Elena Magalotti from Bracco, who's going to talk about the new contrast agent boosting product that we've worked with them together on. And then Dr. Mary Jessel will talk about our collaboration with Telix, who is a radiopharmaceutical company working in a very innovative and exciting space. So I'll just kind of jump in, and I think someone's going to start a timer for me. Maybe Dr. Tannenbaum. Thank you.
All right. Some extra.
So, just as a big overview, the mission of Subtle is to accelerate the world's access to higher quality healthcare through faster, safer, and smarter imaging. So it's a very broad overall vision, and I think that the slides will show you that we're working in many different areas. Oops. I guess that mouse does something else. So first, I want to talk a little bit about our evolving technologies. One of the things I'm most proud about the team is their ability to innovate over time. So, starting from 2020 and 2021, when we introduced SubtlePET and SubtleMR, we've continued to innovate with both new versions of this that have been FDA-cleared, totally new modalities such as synthesis, which is very exciting. You're going to hear more about our partnership with AiMIFY and Bracco. And then moving more beyond acceleration into things that help with radiologist productivity, because one of the things that we constantly hear is that if we can speed up imaging, that's great, but if you're a radiologist, you also need help reading these studies as well. So what can we do to help radiologists be more productive and to do better diagnoses? And these are some of the things in 2025 that are on the pathway, and I'll talk a little bit about those as well. So just a little bit about the growth of the company. The company was founded in 2017. We have been continually had very strong growth, and I think that just speaks to the fact that, the need for more capacity with imaging is just not going away, right? Radiology exams are increasing 5 to 10% a year. At Stanford last year, we had a 15% increase in the amount of studies that we were asked to read. And the number of scanners is there's no way it's going to be able to keep up. And even if it could keep up, there's no way we can pay for all of this. So we need to think of innovative solutions to use our scanners in a much better way. So some of the things I'm most proud about have been the number of patients that we've been able to impact, because not only is this good for MR efficiency, it's really good for patients. Many patients can't tolerate long exams, and even if they could, there's no reason for them to be sitting in scanners when they're sick or ill. So I recently went through the math and calculated that since we started the company, we've saved patients 31 years of time in the scanner. So that's probably older than many of you in the room. And, this is things that they can do that they couldn't do before, right? So I'm very excited about that. The other thing that I'm really excited, and I don't think we talk about a lot, is that this is really a very green type of enterprise. Medical imaging actually is fairly carbon footprint intensive. And if you can scan more patients with the same amount of resources, the same amount of electricity, you can reduce your carbon footprint. You can perhaps scan at lower field, which is also more carbon efficient than scanning at high field, but yet still have the same quality. So I think this is very important, and it aligns with a lot of the ACR's guidelines on sustainability. Okay, so I'm going to talk a little bit first about the newest product release, which is Subtle Elite. I'm not going to go into much detail because I believe Dr. Tannenbaum is going to speak to this. But, basically, the idea is it's a combination of both Subtle HD, Subtle Synthesis, which I'll talk about, and Subtle Align. And the goals are to increase MR quality and speed, to use synthetic MR for additional time savings, and then auto alignment to make it easier for the radiologist to both look at standard scans, but also, more importantly, to follow up longitudinal studies. So HD in itself is a new model that we've developed. The new model is based on new data in which we've had people acquire higher than standard of care imaging and use that to train the models. And because of that, it has more power to denoise and more power to sharpen images. I'm just going to show one example of this because I know Dr. Tannenbaum has quite a few. This is just a prostate MRI. I'm a neuroradiologist, so I have no idea what I'm looking at on the screen, but it certainly looks very impressive to me. Just a little bit about synthesis. So this is a new product that was cleared by the FDA. This is an algorithm that takes a sagittal T1 and a sagittal T2 of the spine, of any part of the spine, and creates a stir image from that such that you don't have to acquire the stir. Now, some of you may know the stir is a very important sequence in the spine, especially for edema and trauma. The trouble is it's also a low SNR sequence, so it's actually very long time period to acquire. So by reducing that and by eliminating it, you can actually get better time savings, but also because you're synthesizing from two very high SNR images, a sagittal T1 and T2, the actual SNR of the synth is higher, and that's been shown in publications that have been peer-reviewed. Another interesting advantage of using T1 and T2 to synthesize stir is that you can actually reduce susceptibility artifact, just because those sequences are less susceptible to such artifacts. And this is an example of a metal rod in the spine, just showing improved quality. And just briefly, a little bit about Align. So I don't know how many of you do 3D imaging, but typically we ask our technologists to reformat that into the sagittal, coronal, and sometimes even the axial planes. And over the years, I've been always struck by the variability of what people interpret as axial or coronal, especially at 2 a.m. So again, I don't think they like the phone calls we make for them to redo it. And I don't think we like getting really poor reformats. So this is clearly something that AI can do and we can automate. And this will be very helpful for following up lesions over time. Even if your PACS can do this for you, why would you want to do the extra clicks and slow down? Just a little bit about SubtlePET. SubtlePET is used for FDG and also other radio tracers. And most recently, we wanted to talk about our new partnership with Telix. And again, I'm not going to talk about that too much because we're going to hear about that in a dedicated talk in a few minutes. Okay, I want to just spend the rest of my time talking about improvements over time. And these are all works in progress. They are not FDA cleared, but they give you an idea of what the roadmap is for the company. So the first, I want to keep on the topic of PET. One of the things that you have with PET that I don't think has been exploited too much is the idea that when you acquire a PET, you always acquire an MR or you acquire a CT. So by using that additional data, we can push the amount of dose reduction or time reduction quite significantly. And this is an example of a PET that you would acquire with a 10-second per bed positioning. And you can see it's quite noisy, not diagnostic. If you actually use both CT and the PET imaging, you can actually synthesize imaging such as this shown on the right. And this is, 12-fold time reduction in this case. And you can see that you could argue that this is a better image than you would acquire with your typical 120-second bed images. The next, I want to talk about synth and the other things you can do with synthesis of images. So we all know that in many fields you like to do 2D imaging, high resolution. So if you're doing musculoskeletal imaging, you might get a coronal proton density and a sagittal proton density fat set. And maybe you want to have a coronal. And it turns out, the information is there on the image, just like it is for SubtleSYNTH in the spine. And so we can use that to create a synthesized image, such as the one on the far right, and, showing, really exquisite detail, but not require the time to obtain it. This can be applied to brain. This is actually the focus of an NIH grant. I'm very proud of the team that they have spent a lot of time on research and development and have gotten funding from the NIH to pursue this. And this idea is that, again, if you can potentially use redundant image information to create other contrasts. And in this case, for example, the flare image in the fourth row, you can see has artifacts. It has non-suppression in the beginning. And if you use the model inputs on the left, you can actually synthesize a non-corrupted flare, or flare. So, I think this is very useful, for example, if the patient leaves the magnet before they get that study, or if you have a protocol that requires it and the patient, they didn't do it for some reason. This is additional information that you can get at any time. And these are just, some additional examples of different combinations that you can do. And in the long term, our thought is that, if we have at least 2 or 3 contrasts, we should be able to produce the remaining contrasts in the group shown here. Okay, I'm going to talk a little bit about our efforts in gadolinium. This is one of the first things that we worked on in the company. And the idea here is, could we potentially reduce the need for gadolinium? For example, it's very well known, or becoming more well known, that downstream of MRI-rich areas, the water is starting to get lots of gadolinium in it. And I'm starting to read articles from the Journal of Marine Biology Pollution, which I've never read before, but they talk about anthropomorphic gadolinium. So we need to be very careful that not only for patient safety, but possibly also for environmental safety, we need to reduce GAD. And this is a study looking at 90% dose reduction. And when you think about this, this is really just a denoising problem, right? You want to denoise the image so you can see a smaller amount of gadolinium and present it in a very familiar way. And we have an NIH grant on this as well. We're also working with Boston Children's closely. And this is moving forward to a large clinical trial with Bayer. The challenge with contrast agents is that they're regulated as drugs. So if you want to change the label, you need to do an FDA trial. And this is not a cheap undertaking, and we're very proud that Bayer has chosen to move forward with us to actually invest the time and effort to do this. But we're very excited about it. The next area which we're equally excited about is the idea of enhancing standard dose contrast. And this is a product called AiMIFY. And this was co-developed with Subtle and Bracco. And you're definitely going to hear more about this from Elena a few minutes later. But this is kind of the idea that if some of you remember the days when you could do double dose to look for metastasis, it was a lot easier to identify metastases. And the idea is, we don't really do that too much anymore. So could we use AI to synthesize that and allow us to see more things and potentially see the things we usually see, but just not take as much time on it? And then finally, the last topic I want to talk about is the idea of intelligent workflow orchestration, which is kind of like this set of buzzwords that you probably hear everybody talk about. And just saying what it means for us is that if you're a radiologist, and especially if you're reading from a site that has many different scanners coming from many different locations, the data that's coming at you is often kind of a mess. It may be labeled differently. If you have hanging protocols, they're almost certainly not going to work. So the idea is to look at the DICOM header coming from the scanner, to look at the image itself to confirm that, in fact, the T1 with contrast is really a T1 with contrast, to perform a quality check to make sure that you're above a certain level, or to monitor your quality over time. To do perfect reformats. And I talked about the brain version, which is already FDA cleared, but I think that standardized planes elsewhere in the body are also really important and will be very useful for longitudinal follow-up. And this is something that AI is very good at. And then finally, if you do all of this stuff, you have a lot of data that you can potentially cull for, how do I improve my system? How do I give feedback to my technologists, et cetera? So just a few examples of what this means. This is just some work done at Subtle, looking at an open data set called ADNI. And ADNI is supposed to already be standardized, but it turns out that, they have, in this set at least, they had 95 different names in their system. And it turned out that using the naming standardization tool, we could reduce these to about 14 series descriptions with about 99+% accuracy. And so, that is just going to make hanging protocols work much better for you. And downstream, if you want to use your data for other purposes, you're going to always have it named in the appropriate way. And this is just an example. On the left is the way it came to us. On the right is what we transformed it into. And, not only are they name standardized, but for example, on the bottom two, very ambiguously named series, we were able to tell that in fact, this is not a post-contrast study, and it is in fact not a fat-saturated image. And that's something that would be very difficult if you wanted to go back and figure that out, or if you're hanging protocols, God forbid, we're going to try to figure out where to put these things. And then finally, quality. Again, this is just an extreme example. We all know what bad quality is, but on the borders, how well do our techs know when to rescan, when not to rescan? Ultimately, perhaps you just want to send the best quality image if you have multiple repeats, because in my experience, sometimes the first one is the best, and maybe we don't need to see all of them. Maybe that'll make our job easier. And then finally, just to emphasize that these work together. Right? You can have a very fast scan. You can apply naming standardization. You can then, enhance the image itself, and then you can reformat it into a radiologist-friendly plane. So I think the exciting thing about the products is that they all kind of work together. And last but not least, if you're interested in getting insight from this data, this is a very rich source, and we can make a dashboard that talks about efficiency across the organization, what scans are coming from where. And, ultimately our vision is not necessarily to make dashboards, because I think that, then people have to look at dashboards, but then to integrate this longer term into large language models to actually get insights out of it. So you can ask a question to your database, but it's created from actual true imaging, not just when the technology is pressed and scan. So we're very excited about that, and my time is now up. So I will say thank you very much for listening to me and pass the baton to Dr. Tannenbaum.
That's going to be very hard to follow.
Just a bit of advice, this mouse is not connected to this.
Okay, so how do I do that? That mouse is connected to that. Great. That's going to be very hard to follow, Greg, mostly because we have some of the same images, and that makes it a bit challenging. Now, I generally don't like to stand up and just talk about product, but in this particular case, I think that's why we're all here, to talk about product. And we're all in the circumstances when it comes, we have to make a decision as how we choose a partner to go to battle every day in our clinical practices. I like to think of the 4 Ps in terms of doing this: the pedigree of the organization, where it came from, where the science comes from, the products that we have in front of us, how they compare to the competition. You want them to be best in class. The pipeline, as you've just heard, what's coming up in the future. Is this a one-trick pony, or is this a company that you can invest in forever? And then, as you've heard today, you can hear a lot about partnerships. Who are the partners that will increase the value of that organization to you? So again, we're going to talk about this Subtle Elite product, and you've heard the different components: Align, HD, and Synth. And you've seen how Align allows you to simplify longitudinal assessment, how HD, I'm not sure any of you are old enough to remember this commercial, but this is not your dad's DLR. You're going to see this is a completely new generation of quality that you can get in the DICOM space. And you'll see some of the work that Subtle has done and some of the validation that we have done in terms of doing the synthetic work. So I'm going to put my glasses on because this view is pretty small. But you can see here how Align would just make some of these images, which look just a little bit sloppy. Is there a pointer here? Yeah, just a little bit sloppy, off plane, hard to interpret, hard to look at serially and turn them into perfectly orthogonal views. When we look at diseases such as multiple sclerosis or brain tumor, we're trying to make sure we get the views as closely as possible to where they were the last time, because it markedly facilitates the speed of interpretation and can affect the accuracy of interpretation. And this tool, uses a very easy skill of deep learning to go ahead and get these images in the same plane, in the correct plane, regardless of what plane the patient is actually scanned in. It gets all of this correct. And I think that is clearly important. As a reading radiologist, you know how hard it is to do serial evaluation when the images are the same, visit to visit, almost exactly the same. it's easier to read. And you know what? That's a big factor in plenty. As you probably know, I was a director of imaging at a large academic institution. I just finished a stint as the director of advanced imaging at the largest outpatient center, 1,000 radiologists. We really care about how hard the radiologist has to work to deliver the value they need to deliver every day. All right, let's get back to deep learning-based image reconstruction, and we know what this does. It's a very powerful noise reducer. It gives you images with lower noise, with perhaps even increased sharpness, increased contrast resolution. It does all of this without affecting the quantitative or qualitative integrity of the image and can actually reduce artifacts. This tool that we're talking about today, SubtleMR, which we have rolled out throughout RadNet, is a universally capable, broadly applicable, DICOM-based suite of applications. And I say suite because it does 2D, it does 3D, it does radial applications, all of which that can be done with this particular product. During my time at RadNet, we had institution-wide use on our fleet, and by the time I left, we were processing roughly 45,000 exams per month with never a single day of disruption in that process. And that's really important. Now, when you think about the DICOM space, you think about SubtleMR, they actually can do things that a lot of the OEMs haven't enabled, right? Some of the OEMs can't do radial scanning. Some of the OEMs can't do diffusion imaging. You have the ability to do everything in this particular case, and this allows you to do this type of work in pediatric cases where you want to use propeller modified radial trajectories to suppress motion. You see on the left-hand side, the standard of care takes 76 seconds, whereas the accelerated and then processed subtle HD scan that you've heard about is only 49 seconds. And here you can see a propeller diffusion with the raw image off the scanner and what the subtle HD does. And if you're used to DICOM-based image reconstruction, you know you haven't seen this type of sharpness, this type of dynamism that we typically only associate with the vendor's case-based method, but this is what you're starting to see with this subtle HD, which is pretty impressive. Now, deep learning reconstruction is clearly an evolving standard of care. There have been many publications. These are a couple that we did. We looked at the spine and were able to get better quality in less time. You can see the standard of care here on the left, the accelerated image on the right, which is clearly deteriorated. I mean, that's the game, right? Destroy your images, save the scan time, and restore the quality with deep learning. And we were better and faster in this particular circumstance. Another paper, we actually did volumetric imaging, quantitative and clinical assessment. And when we accelerated and then processed with the original SubtleMR product, we're able to maintain the image quality, actually exceed the image quality, yet get the same quantitative assessment from those studies. Now, again, we're all familiar with SubtleMR, I hope, but now we're here to talk about subtle HD. And as you heard from Dr. Zaharchuk, this is an evolution from the SubtleMR algorithm. It's trained on much more data, higher resolution data, and as Greg put it, higher than the standard of care so that you can get a product that really is quite superior to what we're accustomed to. This is a very pretty SubtleMR image, in my humble opinion. This is the same image processed with the new algorithm, which aiming a lot higher. Again, this is SubtleMR as it currently exists. This is what the new algorithm does to the same data set. SubtleMR on the left, the HD version on the right. And I think you can see it is clearly an upgrade from where they were before and very much akin to what you expect to get from the latest state-of-the-art OEM-based systems. And this was, honestly not quite the case before, and it is now, and in many cases can actually outperform. I believe this cardiac work, which you see here, is a works in progress, but you can see you can reduce the scan time, and you can actually see the image quality is actually slightly improved. Here you see a two-chamber view. Again, the original scan looks fine. The process scan with subtle HD is clearly better. And here from a GE scanner, if you look at the aortic valve, really crisply delineated in likely less time. All right, some more images, standard of care on the left, subtle HD on the right, less than half the time, and really, I think clearly better than the standard of care in terms of sharpness. Here's a typical image off the scanner with acceleration. You see the noise levels, and here you can see what very much a modern deep learning reconstruction baked look to the image with virtually no noise and high sharpness and high contrast resolution. Here's another case, an accelerated image, and this is what the HD algorithm does with that image. Much, much sharper, basically as good as you can make an MR scan look. Here you see an image. We've got the standard of care on the left and the HD rendering on the right, sharper, cleaner, and it done roughly 57% faster. Now, here's just some typical images. I think some of these images ended up in Dr. Zacharczyk's presentation. This is the image. These are the images right off the Philips scanner. 353 for the T2, 240 for the T1. I think the annotation is wrong. 240 for the T1. And here you can see what SubtleMR does. Subtle HD does to these images. Sharpens them up, reduces the noise, improves the contrast resolution. Here's a case, standard of care, T2, T1, typically thing you might see on, say, maybe an older generation machine with the OEM recon. This is what it looks like with the HD. Clearly sharper, lower noise. Now, the same algorithm can be used to process MRA, taking all that noise down and making the image, the vessels look sharper and more conspicuous. You can see when you process the full MIP, it clearly creates an enhanced product. This is an abdomen image. For those of you who are neuroradiologists like myself, this is the standard recon. If I bring up the deep learning recon from the OEM, it gets a little bit better. And I think the Subtle HD algorithm is every bit as good. Now, sometimes it actually will startle you. This is the fast image from the OEM. This is the HD version on the right. This is a lot different. This is a lot sharper. And if you compare it to the OEM version DL, in this particular case, Air Recon DL, you can see that the image on the right, the HD version, is actually superior, and it's pretty remarkable. Here you see, again, this is from GE data. This is an accelerated scan on the left. You can see the graininess that radiologists love that actually represents noise. And when you look at the OEM version, you can see clearly cleaner and looks like a superior image. Here again, the accelerated image, and this is the SubtleMR HD image. Let's take a closer look at the two of these. Again, state-of-the-art algorithms. The one on the right's from the DICOM space from the Subtle folks. And if you zoom in closely, you can clearly see the gray-white differentiation is a little bit better. You don't have any of these jagged artifacts in the reconstruction. It's a pretty impressive picture. And I don't think you would have said last year that you could do better than the OEM version with this in this space. And they really are doing a lovely job. Raw image on the left, Subtle HD on the right, pretty nice. OEM DLR on the left, Subtle HD on the right. I don't think there's anything there that is lacking at all. Again, look at how the noise reduction works here, but look at the sharpness preservation, doing really every bit as good as, in this case, the Siemens boost algorithm. Again, very nice look to the image, cleaning up the noise of the accelerated image, very much like the OEM, if not a little bit better, and that would be in the eyes of the beholder. Again, this is the OEM DLR, this is the Subtle HD DLR, and I think you're really quite respectable. All right, just one more time, just to give you images from head to toe. Raw image on the left, Subtle HD on the right, sharper, little less noisy. And you can see compared to the OEM DLR, I don't know that you'd be able to pick out one versus the next. All right, so the message here, progress, evolution in the product, and frankly, down to the point where, you could actually start thinking about this tool as an alternative to the OEM if you chose to manage your fleet with one solution as opposed to multiple different solutions. All right, what's next for deep learning reconstruction? This is clearly a synthesized image, and this is our opportunity to talk about synthetic image generation that Dr. Zacharczyk brought up. He brought up one of the significant concerns we're seeing now, for folks who really care about contrast imaging and sustainability and greenness, is that we're starting to get more and more concerned about gadolinium that is going into the environment. As Dr. Zacharczyk showed you, the Subtle folks have got a grant to study this particular issue. You can see, and you've seen some of the work, which Dr. Zacharczyk described as noise reduction. To me, it goes beyond noise reduction into contrast, resolution, and enhancement of certain contrast, but he's got data science background. I'm just a Joe Sixpack from the suburbs. You will hear a lot from the Bracco folks here today who are partners with Subtle Medical about the value of using this commercially available product, AiMIFY, to make contrast more conspicuous. Why do I want it more conspicuous? Let's put my administrator's hat on. We're reading more cases every day, okay? There's nothing like high contrast images where you can see the finding easily to get you through the work faster and more accurately. This is a significant workflow tool. It is probably a quality tool. I look forward to see the way this is rolled out and used in the community. Just another example here. You've seen this before, but come on. Imagine that lesion is a quarter the size. Are you really you'll struggle with that. But now you see it just pops. When things pop, it's easier to read. My entire mission in crafting images for an enterprise is make the images pretty and make them easier to read. This is a very clever application of this technology. Now, other things into the works in progress space, you talked about interesting things that you can create from the existing information and images. You can actually create an MRA from routine images. Again, works in progress. One of the most promising works in progress that I think could have implication every day is the ability to take a T1 and a flare and synthesize a double IR. This is all subtle works in progress work. You can see 3 different examples, but we all love double IR. I love double IR, okay? It's incredible for the posterior fossa. It has amazing contrast resolution. The problem is it takes a long time. Deep learning helps with that, and it's noisy. Deep learning could help with that. But you know what? 100% time savings with that kind of contrast resolution. Pretty exciting. By the way, if you want to see the results of this particular trial, I'm presenting this abstract Thursday morning. If anybody who's still here Thursday morning, please come and join me for this abstract. But you can see what we were able to show is that the gray-white contrast in blue, the lesion to white matter contrast in yellow is substantially higher. And when you start thinking about image synthesis, maybe somebody gets a little nervous, but it's really important to show that it had the exact same performance through serial evaluation, serial reconstruction. So it's really kind of compelling stuff. Greg showed some interesting stuff that really ties into my area of interest. We're trying to get things right the first time. We don't want patients to come back. We don't want a prolonged length of stay. We want it to be an easy experience for the patient. And if something fails like this flare, either due to susceptibility or to motion, it's nice to be able to create a corrected flare from the existing data. Greg showed how you can actually take the existing images and create an additional contrast in an additional plane to avoid doing the work. He also showed you some interesting work where they can take a 2D T1, a 3D T2, and create a 3D synthetic stir. Stir takes a long time. Gee, I'd love to have it in all 3 planes on occasion. I don't want to take the time to do it. Imagine you could just take the existing data and make reasonable quality reformats. Look at the difference between what you would get if you tried this on your own. Here's the pointer. You tried this on your own. It doesn't work. 2D data doesn't work that well. But look at what you can do with this synthetic data, and you can get a better display. Better display sometimes makes a faster, more accurate diagnosis, but it almost always makes a better communication. Now, you heard about the grant that they got looking into synthetic imaging. The first actual product hitting the market, and it's available now, is the ability to take the existing data and create a synthetic version of a stir that would replace the actual version of the stir. Here's just a nice example of these 2 examples. Imagine you could take this case, which is compression fracture, take the real T1, take the real T2, eliminate the actual original stir, and just use a synthetic stir. And you heard Dr. Zaharchik mention some of the benefits here, and that is you're working with a high-resolution, high SNR T1, same thing with the T2, and you're not having to deal with the challenges, the long scan time, the low inherent SNR of a real stir. Osteomyelitis indiscitis, real T1, real T2, real stir. Imagine you could synthesize that stir. Now, we published this paper in the AJNR last year, and it performed really, really well. It had the same clinical designation. The side-by-side extent and conspicutive lesions was rated the same. And of course, the image quality was superior across the board. And we just did the typical evaluation you'd expect. Just for the neuroradiologists in the room, you can see, a couple examples of myelopathy. And you can see here a couple examples of bone tumor. You can see here really excellent conspicuity, compression fracture, soft tissue injury from trauma. Again, really nice rendering. In our particular trial, we showed across the board that the images had better SNR and they had less artifact. And really one of my favorite topics that Greg stole from me, which makes me very sad, is that fact that when you do the synthetic stir, you get less susceptibility. So here is where the MR geek in me will come out and explain to you why you have less susceptibility artifact. When you try to build SNR that isn't there, you drop the bandwidth. That's what happens on all of our stir scans. They're lower bandwidth than anything else, right, my friend? He knows. He taught me everything I know about this particular topic. When you do a T1 or a T2, you have lots of signal. You actually leverage that signal to go to higher bandwidth, to get better slice formats, less susceptibility artifact. So since you're creating the synthetic stir from the high-res, high-bandwidth T1, you will get less artifact on the images, and that's a significant benefit. So in this trial, as you've already gotten a sense, we looked better than the conventional stir, but performed clinically to the same standard. All right, so to summarize what synthetic imaging will give you, you can get new information. Lots of interesting new information. The first one that is available clinically is to get the stir from the T1 and the T2. But you've seen the potentials and how that might get you out of trouble or might give you additional information or might give you a substantial scan time savings. I think, I tend to be a skeptic. Prove it to me. When I presented this to the RadNet team, there was amazing enthusiasm for dropping the original stir and trying to use the synthetic one. Now we all have to prove this to ourselves. Since it doesn't cause any scan time, you can easily do the comparison. But I suspect that in many cases, if not all, we will learn to be very comfortable with the synthetic version. We talked about the try to get things right the first time right thing, avoiding callbacks, and again, it all affects efficiency. Now, by the way, here's one of my favorite things, right? The patient moves, the tech repeats the scan, the patient moves again. You can do this all day long. You're not going to get anywhere. You can't win. Imagine that if you had the motion, you just created an image that has motion free. I think that's pretty cool. And I think he's just another example. It's hard to get this thing right once the patient shows motion. All right, only a couple of seconds left just to talk about what these benefits that avoiding a series can give you. Now, this is from a legacy scanner in the RadNet fleet. It's an old machine. It was running SubtleMR and not SubtleHD and SubtleMR. And they were able, they did a typical lumbar spine for this particular clinical practice, 5 sequences, axial T1s from nose to toes, basically, on the lumbar spine. It was 14 minutes of cumulative scanning. All right. When we added SubtleMR to it, it got down to less than 10 minutes of scanning. Not bad. 15 to 10 is pretty good. Now, if you manage to just take that same SubtleMR performance, but eliminate the stir, we're down to 7 minutes. Now, what does that mean? That means that with just adding SubtleMR, not SubtleHD, but SubtleMR in our practice, we save 32% of the time. But when we added in the fact that we could use the synthetic stir rather than the real stir, we got over a 50% time savings. And as you can see, it looked like the slide was duplicated. As you can see, that's fairly modest compared to what you're going to be able to do with the Subtle HD product that is in the Elite package. So we talked about a lot of things. We talked about how the value of align correcting images so the images look the same from visit to visit. They follow standard parameters, makes longitudinal assessment made easier. I wouldn't say it's easy, but it makes it easier. You heard my joke that the MRHD is not like your dad's Oldsmobile. It really represents a new standard of care compared to what we're used to in the DICOM space. Honestly, as a jaded imager, I am just astonished by what I see there. And the synthetic piece, which I think is pretty exciting as well. So since I'm the moderator and I'm responsible to getting off stage on time, I will go ahead and finish my presentation and take this opportunity to introduce our next speaker, Elena Maglotti, sorry about that. Please come up and join us here on the stage and you'll take over. This is your thing, you could use the case for this.
So thank you for the kind introduction. Try to build on the good messages that were already given. Thank you to the Subtle team for having me here. Thank you, all of you, for being with us today. Last year, I was standing in the back of this room, was crowded as it is today, and it was just the beginning of the collaboration between Bracco Imaging and Subtle Medical. The announcement about the global partnership went out in September 2023. This is about a global partnership. This is about the development and the distribution of a new AI technology.
We lost our time.
And this collaboration can leverage on the company expertise in their respective domain, contrast imaging for Bracco and AI-based image reconstruction for Subtle Medical. 1 year after that, I'm glad to say that this has been a successful collaboration. Bracco and Subtle Medical received FDA clearance for a new software as a medical device. And I'm glad to say, on behalf of Bracco and Subtle Medical, that today AiMIFY is available in the market. This is new AI technology for contrast enhancement. AiMIFY means targeted amplification. Targeted amplification. And I'm going to tell you more about this. But before then, let me say why Bracco and AI, and again, why Bracco and SubtleMedical. AI is becoming another key ingredient of the recipe of a good image quality, just like contrast media. So this is yet another opportunity for Bracco to do better what we have been doing since years. And SubtleMedical was a partner of choice. They are pioneers in high-based image quality, but also in contrast enhancement. On one side, noise reduction. Here's the goal is to restore image quality from accelerated images. On the other side, dose reduction. Here's the goal. Here the goal is to restore a full contrast enhancement by a low dose, from a low dose, where low means lower than the standard of care. What's in the middle? In the middle, there is Bracco and SubtleMedical. This is about AI technology for contrast boosting. Here's the goal, is to predict and amplify contrast enhancement starting from a standard dose of the gadolinium-based contrast agent. Higher contrast enhancement at a label dose. So what if you could predict high dose-like appearance from your brain MR images? AiMIFY is a pre-trained model, which is taking in inputs a pre-contrast image and a post-contrast image. The result is a corresponding image where the signal intensity of the structures uptaking contrast has been elevated, which means the contrast enhancement is higher than you will have on your standard image. On the other side, AiMIFY, it is not boosting what it is already hyper intense on a pre-contrast image, like in this example. So the signal intensity is maintained because the tissue, this is likely a scar tissue within the tumor resection, was already hyper intense on the pre-contrast. But AiMIFY obviously is not only amplifying the pathological issue, which is enhancing, is also amplifying physiological tissue like vessels. So this is another example to show on one side a lesion that has been enhanced, but also some vessels. So vessel conspicuity has been also enhanced. While this is unlikely to impact the diagnosis, still we are working on making sure that we can return to the clinician something it is used to. So the team here, this is still on research, but is already working on vessel suppression so that the signal of the vessels is back to what you have in your standard of care images, but still the lesion has been amplified. So some messages. AiMIFY is innovation, and why that? Because AiMIFY is the first product of its kind which identifies brain tissue uptaking contrast and selectively amplify the contrast enhancement of that tissue. Selectively amplifies. This is up to 2 times the contrast enhancement you would achieve with a standard dose of the gadolinium-based contrast agent. Up to 2 times. This is measurable. AiMIFY is virtual relaxivity because it is about increasing the lesion visibility by improving image quality metrics. And this is true for both small and large lesion. And this is done without changing your standard of care. This is post-processing tool after image acquisition. And finally, AiMIFY, it is virtual dose flexibility. You can get high dose-like appearance on demand if you need it, when you need it. And it's a safer alternative to higher gadolinium dose and doesn't interfere again with your image acquisition. It's just done after that. AiMIFY does also seamlessly integrate in your workflow. And this is because there is no user interface. This is because its performance has been proven against images coming from multiple scanning vendor. It can run on the SubtleEdge platform, which ensure interoperability with existing medical device data systems. And the final image is sent back to PACS together with the native images. So you do not renounce to your standard of care, but you have additional images for you to look at. So now, what is it there for you? What if you could boost your diagnostic confidence without increasing your patient gadolinium exposure? Some example. So this was already presented previously. We have pre-contrast image, post-contrast image for a patient with had a lymphoma. The lesion is already visible on the post-contrast image. And also, you can see the edema surrounding the lesion on the pre-contrast image. This is how the AiMIFY image looks. You will agree that the border delineation is simply much more visible on the AiMIFY image. And potentially, this could bring to a better quantification of the volume of the active tumor. This is a lymphoma. What if it was a primary tumor? Another example, we have a patient with multiple metastases. In this case, the quality of the image is also very poor. Noise and motion artifact. There are lesions already visible in the post-contrast. There are other, a little bit smaller than probably would have been missed. But you can see those on the AiMIFY image more easily. Why that? It is not just about noise reduction. It's also about amplifying the signal intensity of the contrast-enhancing tissue. Another example, a glioma resection. We can clearly see the border of the resection already on the pre-contrast image. Again, AiMIFY does not amplify what is already hyper-intense in the pre-contrast, but there is tissue which is actually uptaking contrast. We can see on the post-contrast, but maybe we can see that better on the AiMIFY image. What if it's this tumor recurrence? Another example, a patient who underwent the MR exam for suspicion of autoimmune encephalitis. Looking at the causes of that, we have a post-contrast image, very noisy, a lot of movement artifact, which can be removed by AiMIFY. But on top of that, signal intensity can be amplified. I'm not sure many of you were able to see the little tiny lesion on the post-contrast image, but I would say you can see all of them on the AiMIFY image. So could AiMIFY make your life easier? So I'm close to my conclusion. Let me remark that AiMIFY is about improving image quality, and it is about increasing contrast enhancement, just like higher relaxivity. What if you could combine them together? What if you could maximize the benefit of higher relaxivity for your brain MR images? And let me further elaborate that. What if you could maximize the benefit of higher relaxivity at half the gadolinium dose? With that, I'd like to thank you very much for your attention, and I invite all of you to come at the Bracco booth or the Subtle booth to know more about AiMIFY. Thank you.
Thank you. That was beautifully demonstrated and explained. Our next and final speaker is Mary Jessel from Telix Pharmaceuticals.
Thank you. Great to be here to speak on Telix and Subtle's partnership and the future of Theranostics. Very excited about our partnership, and a quick disclaimer that the information presented today is for educational purposes, and Illuccix gallium PSMA 11 is approved in the US. The other therapeutics being discussed is under investigational use. But before I get into our partnership, I do want to highlight Telix and who we are. We are a leading global leader in radiopharmaceuticals. We have headquartered in Australia with global operations, and we also have our business is quite unique with a integrated business across 4 radiopharm, and it brings together the focus on our mission and our purpose to deliver on therapeutics for patients with a theranostic approach. Precision medicine is also a focus where we are to advance imaging, which is allowing treatment decisions. And then another pillar is our medical technologies around the interventional surgical platforms with AI dosimetry software, all founded on our radioisotope supply. This delivers medically important radioisotopes and also our Telix manufacturing solutions. This offers our bioconjugation, our manufacturing capabilities, and together offers sets us up for success for our clinical trials as well as our commercial scalability. And you can see here that across our pipeline, our portfolio, with a focus of prostate, with a theranostic approach, kidney and renal, brain, and musculoskeletal. And today, our pipeline really does speak to where we see an increase in cancer incidence and mortality across subtypes. And what was alluded earlier is that there's a lot more cancers being, the incidence is increasing with more clinical trials coming to space, as well as more therapeutics coming into the commercial as well. And so this puts a burden on imaging facilities as well as the capacities of the cameras and reading radiologists. And so why we partner with Subtle is essentially this, to help with the efficacy and effectiveness of patients. And the gaps and areas of improvement we see is really that volume of patients that are coming in. And we can recognize that patients are being scheduled out further if there's a camera capacity or due to limitations of cameras at treating facilities. And then also it will help with the amount of time a patient's under their scanner, helping with the amount of time that a patient needs to be under there, as well as improving the operations of the imaging facility. Together, this partnership really focuses on improving the effectiveness for patients and for facilities and for physicians. So a little bit about the partnership. We're starting with prostate cancer and looking forward to the rest of our pipeline. But Subtle is an FDA 510 cleared with a deep learning algorithm for faster imaging without compromising imaging quality. And this workflow, again, is compatible with any PET scanner, working with the Subtle Edge, their deep AI proprietary algorithm, and then with the enhancing the imaging compatible with the PACS and workstation, and then providing those enhanced images to the reading physicians. And with that, what we envision here is, looking at the current, the current time of performance right now. If you think about the patients and the workflow and optimizing that, you see about 28 minutes or so, or 25 minutes for a patient to be scanned. And so fitting 2 patients for a PSMA scan for PET, for example, is, within an hour, that's 2. But with the partnership with Illuccix and Subtle's AI, you can add another patient in there. So it really optimizes the patient workflow. This adds the value. This is a innovative technology that really speaks to, represents the advancements in this field, adding multiple numerous benefits across not only patients with reducing the wait time and the time under the scanner, as well as facilities, medical facilities, increasing the performance. It can also extend the lifetime of a scanner that potentially is older. and also for the workforce supporting the technologists, as well as the radiologists, the readers with improved workflow and denoising with motion artifacts as well. And together, this is an example I like to showcase is what this partnership can do. So this is on the left is a, you can see like which one would you say is done with subtle and one without. Could you guess at all? So the left is the one with acquisition time with 28 minutes with original time scan, and then on the right is with SubtlePET integrated in there, and so that acquisition time is cut down by 75%, and you can see that the image quality is not compromised there with a faster scan time. And again, this one is another prostate cancer imaged with Illuccix gallium PSMA-11, and can you guess if which one was done with a subtle integration and one without? And you can't. On the left is 28 minutes, and the left is on the right again is with the subtle, and again that shows a 75% time savings. So we are very excited around this partnership because we're starting with prostate cancer imaging, but looking forward, we are very excited to move forward with our kidney and our brain with an anticipated approval next year. So we value this partnership with Subtle, and we're going to move with the future of Theranostics in our pipeline. And this last slide, I like to just to illustrate zirconium imaging, where we are very excited about a zircon trial, which is to characterize clear cell renal carcinoma, and wonder if this can play, but that helps. This paper was pivotal trial phase 3 was published in the Lancet Oncology this year, and very excited about that. And looking at zirconium imaging also in mesothelioma, and investigating in our starbursts and other solid tumors as well. So we are very excited around different medically important radioisotopes, starting with prostate and gallium and moving into other radioisotopes. I want to thank you and thank Subtle for this important partnership, as we see that this is an incredibly unmet need and innovation in the field that's needing for the future where radiology is moving.
Thank you.
Thank you. We are all happy to hang around for a bit and answer any questions anyone from the audience may have. Are there any questions or comments? If you had in your hands the ability to enhance the contrast appearance, would you use it? Anybody? It's a good few hands in here. Yeah, it just makes it a lot easier. I think so. Anybody using SubtleMR now who would, in their mind, anybody using SubtleMR now, the original product? You're all potential customers then, I assume. Good for them. Good for them. I think that's great. Well, I don't see any questions in the room. I'll let everybody go. And thank you very much for making time for us today. And thank you very much to our wonderful panelists.